Your teeth could be the cause of health issues in other parts of your body, and here to share how permanent dental implants could solve many of your health problems, we welcome from Sleep Dentistry Defined Implant and Laser Center, Dr. Heath Lampee. Good to have you with us again.
Thank you so much, Helen. Appreciate it.
You talk a lot about how a lot of your patients come in with health issues, and as you go to find out, do more research, it's related to their teeth.
So a lot of my patients, they do come in with many health issues. They're wondering why their energy levels are low, why they're on so many different medications, why they can't manage their diabetes, why their blood pressure is out of control, why their autoimmune disorders are doing poorly.
Right.
And a lot of these people haven't been to the dentist in 5, 10, 20, 30 years.
Wow.
So it kind of starts with, first, people don't like going to the dentist.
Right.
I get it. You know, who wants a drill in your mouth, right?
Right.
So they don't go to the dentist for a long time, and then all of a sudden, over time, teeth chip, gums get inflamed, and then as that gets worse, teeth can break, gums can start really bleeding, abscessing. Sometimes they feel like their sinuses are full or infected, and it's not a sinus infection, it's a tooth draining into the sinus, pus, basically. So they don't know that they have all these infections.
You have people screaming. Can you hear the people? It wasn't just me that did that. I heard it elsewhere in the building.
We've got to have a good time with this. It's all about passion, right?
Yes.
So they come in.
And they're embarrassed, probably.
Well, yeah. And a lot of my patients are ashamed, but they don't need to be. I mean, there's a problem, and we can fix it.
Right.
We can be adults about this. There's no shaming. So they come in, and we figure out why they're not feeling so well. And if somebody has 10 or 20 infections in their mouth without them really knowing it, because a lot of these infections are very quiet. They're under the radar, but their body and immune system are constantly fighting them.
Right.
And so it's like a low-grade infection for years and years and years, so it totally overloads the immune system. So they're getting sicker easier, they're feeling worse. So what we do is we figure out these are the infections in your mouth. And a lot of times if it's been 10, 20 years, oftentimes the teeth need to come out.
Yeah.
They are goners, they are done. They have caused so much infection and damage that we just say goodbye. So sayonara. And so in the course of one day, we can actually take the teeth out. And after I get the teeth out, I actually kind of scoop out the infections. I spend a while doing that. And then I flush them out with antibiotics, and then I'll put dental implants in the same day. And all this is happening while they're sleeping. It's good.
Nice.
They're happy, I'm happy.
Right.
And so we get the infection out, we put dental implants in, and we can actually do impressions that day for permanent teeth, and that gets screwed in the
So
course
initially
of 24 hours.
they're kind of the in-between implants, and then you go to...
Yes, but so in 24 hours, they can get the implants, we do our impression, in 24 hours, they're gonna have a screwed-in set of teeth. Now, they're temporary teeth, so you gotta baby these little guys. I mean, they're for smiling and like soft foods, they're not for chewing steak yet.
Right.
And it takes really about 4 to 6 months for those implants to really firm up, for the bone to grow around them, for the gum tissue to grow around them, for them to be able to withstand these delicious things that we all want to eat.
And I bet you change, first of all, then they start feeling better, and they look better, of course.
So not only when somebody goes from no smile to a good smile, it is life-changing. But also when you take out all that dental infection and finally the body systems can feel better, over the course of 4 to 6 months, my patients become different people. And that's what makes me so passionate about what I do, is seeing that change. And not only that, but they're probably going to have better lives, longer lives. Their diabetes is going to get better. I have a lot of patients that quit smoking. Autoimmune disorders get better, and they're at less risk for first heart attack and first stroke.
Did we take a look at the implant as they look? Once they're in there.
So that's actually implants on a little black velvet piece of paper, so we can just see what they look like outside of the mouth. That's a full arch set of implants on 4 implants. And then in the mouth, we actually will screw that in permanently. That never comes in or out. That's made out of full porcelain.
Wow.
And that's just a lower, just for example, so we can mimic the pink gums, the teeth, and it's the whole new smile and rejuvenation.
Fantastic. Oh my gosh, that is awesome. And they've got to talk to you about how good they feel, and then it's how do you clean the implants?
So you have to use a water pick. So that's the one that little shoots water underneath the gums, and then you can also use these things called proxa brushes. So they've got to clean them, just like they did normal teeth. So it's a whole new set of teeth, it's a whole new lease on life, but they do have to clean them as well.
And they feel better, and they look better. Yeah, that's
great.
Fantastic. Dr. Heath Lampee, I want to tell everyone if you'd like to find out more, you can contact Sleep Dentistry Defined, 503-646-2273. And of course, we'll put all that information for you on our website at katu.com. Doctor, thank you very much. Appreciate it.